Hello, my name is Dr. Gertie Chimeka Anyanwoke. I am an infectious disease specialist and I practice in Baton Rouge and Gonzales, Louisiana. This is another update on coronavirus disease 2019, also known as COVID-19. In the next part of this video series, we will be discussing the detection of antibodies and antigens to SARS-CoV-2. COVID-19 infection can also be detected indirectly by measuring the host immune response to SARS-CoV-2 infection. Serological diagnosis is especially important for patients with mild to moderate illness who may present late beyond the first 2 weeks of illness onset. Serological diagnosis also is becoming an important tool to understanding the extent of COVID-19 in the community and to identify individuals who are immune and potentially protected from becoming infected. The most sensitive and earliest serological marker is total antibodies, levels of which begin to increase from the second week of symptom onset. Although IgM and IgG ELISA have been found to be positive even as early as the 4th day after symptom onset, higher levels occur in the second and third week of illness. In a study of 140 patients, combined sensitivity of PCR and IgM ELISA directed at nucleocapsid antigen was 98.6% versus 51.9% with a single PCR test. During the first 5.5 days, quantitative PCR had a higher positivity rate than IgM, whereas IgM ELISA had a higher positivity rate after day 5.5 of illness. ELISA-based IgM and IgG antibody tests have greater than 95% specificity for diagnosis of COVID-19. Rapid point-of-care tests for detection of antibodies have been widely developed and marketed and are of variable quality. Many manufacturers do not reveal the nature of antigens used. These tests are purely qualitative in nature and can only indicate the presence or absence of SARS-CoV-2 antibodies. The presence of neutralizing antibodies can only be confirmed by a plaque reduction neutralization test. However, high titers of IgG antibodies detected by ELISA have been shown to positively correlate with neutralizing antibodies. The long-term persistence and duration of protection conferred by the neutralizing antibodies remains unknown. In conclusion, for serological testing, using available evidence, a clinically useful timeline of diagnostic markers for detection of COVID-19 has been devised. Most of the available data are for adult populations who are not immunocompromised. The time course of PCR positivity and seroconversion may vary in children and other groups, including the large population of asymptomatic individuals who go undiagnosed without active surveillance. Many questions remain, particularly how long potential immunity lasts in individuals, both asymptomatic and symptomatic, who are affected with SARS-CoV-2. A lot of the information above came from JAMA publication. The next part is to discuss COVID-19 antigen tests. The FDA, in the early part of May 2020, has issued the first emergency use authorization for a COVID-19 antigen test. This new category of tests for use in the ongoing pandemic can quickly detect fragments of proteins found on or within the virus by testing samples collected from the nasal cavity using swabs. This test is authorized for use in high and moderate complexity laboratories satisfied by the CLIA, as well as for point-of-care testing by facilities operating under a CLIA certificate of waiver. As we now know, the PCR test can be very accurate, but running the tests and analyzing the results can take time. One of the main advantages of an antigen test is the speed of the test. This test can provide results in minutes. However, antigen tests may not detect all active infections as they do not work the same way as a PCR test. Antigen tests are very specific for the virus, but are not as sensitive as molecular PCR tests. This means that positive results from antigen tests are highly accurate, but there is a higher chance of false negatives. So negative results do not rule out infection. Now, with this in mind, negative results from an antigen test may need to be confirmed with a PCR test prior to making treatment decisions or to prevent the possible spread of the virus due to a false negative test. This, I can see, being advantageous in our ability to test more patients, and for those patients that are negative, now reflects that to reverse transcriptase PCR testing. Again, antigen tests are so important in the overall response against COVID-19 as they can generally be produced at a lower cost than PCR tests. And once multiple manufacturers enter this market, they can potentially scale to test millions of people per day due to their simpler design, and this will help the country better identify infection rates closer to real time. In the next part of this video series, we will be discussing other issues as it concerns testing for COVID-19. You can find my other videos on my YouTube channel at Wellness Care Incorporated. Again, I am Dr. Gertie Chimeka Anyanwoke, infectious disease specialist practicing in Baton Rouge and Gonzales, Louisiana.